My name's Leonard. I'm an occupational therapist and I work with the OT service. This section is about supporting carer posture. So when assessing and making recommendations around bathing, it's essential to consider the safety and the posture of the carer. Backcare.org states that around 70% of unpaid carers already suffer from back pain, which is the world's leading cause of disability. The Chartered Society of Physiotherapy in 2016 suggested that bending, twisting, and heavy physical work should be minimised, and a balanced approach should be implemented where carers consider not only the need of the patients and the people that they work with, and the goal of care, but also to consider their own needs as well in the process. So the aim of proper and good posture is to reduce the physical strains and stresses on the lumbar spine, but also on the whole musculoskeletal system. For tasks that involve handling patients, these principles can be adapted and need to consider the following things. So we need to keep to a walking stance. So that's putting one foot in front of the other, the legs slightly apart with the knees flexed. Need to think about transferring the body weight using the strong muscles of the legs. Avoiding overreaching, getting the person to move closer to you or only handling the side of the person that's closest to you. And raising the bed height or the height of the bath to make sure that the person is at a good level and maybe sinking down with the hips and the knees. We also need to think about raising the height of something, whether that be a bed or a bath, and sinking down at the hips and knees. So it's really important to work with pieces of equipment that can adjust in height to make sure that the carers aren't putting themselves at risk of any injuries. So if we take, for example, the process of showering somebody in a chair, maybe something like a tilt-in space shower chair, the turning circle of that piece of equipment is quite large, and sometimes space is restricted within a bathroom. We think about when you're showering somebody, and especially when you're attending to the lower half, that might involve twisting and bending movements, especially when you're trying to direct the shower at lower body parts and intimate parts of the body, and that can put carers at risk. So when you're making recommendations within a bathroom and you're taking into account the carer's needs, again, sometimes it's very quick to make recommendations that involve the provision of a level access shower. But if you think about a carer and when they're looking after somebody and assisting them with bathing, usually there's a shower screen in front of them to keep them dry. Sometimes they're at half height. That can sometimes cause somebody to reach out of their centre of gravity and adopt a posture that may put strain on the lower spine. If we take away that shower screen, then the carer is at risk of getting wet. And then again, that might make them adopt unfavourable postural positions because they're trying to keep their feet dry. And I know I've worked with some families where the parent have wanted to enter the shower with the child so they can get fully involved in the showering process, and they've had to just have a shower at the same time. We need to think about the implications for the privacy and dignity of the parents when we're caring for children, and this might not be appropriate in the long term. So when we're thinking about bathing, it's really important to look at the needs of the person, but also the needs of the carer as well. There are baths available that adjust in height. These can be raised and lowered to an optimal height for the carer, therefore reducing the risk of injury to the carer, whilst also providing the best care for the person in the bath. Thank you for listening.